to school can be bittersweet for many kids as routines change and stressors like bullies and difficulty learning return with the new school year.
Yeah, as part of our back to school coverage now, Liam Healy spoke with a child psychologist to gain some insight into how to start the conversation about mental health and keep it going. Liam.
Yeah, that's right, Adam. I spoke with Dr. Betty Lai, an associate professor in counseling psychology at Boston College, who said that one of the best ways to start the conversation is just asking something as simple as, how are you doing?
A lot of times as parents, we shy away from these conversations because they're hard to have, and people worry that they're opening up sort of a Pandora's box. But we know from the research side that it's not bad to ask, and often children are relieved that you do ask because otherwise they're holding these feelings and feeling like they can't communicate them to you.
Deciding when and if you need to have a conversation like this can also be difficult, as everyone is going to be unique in how they display when they're struggling.
The first few days of school, everybody feels a little bit anxious, but is that feeling of anxiety going on for longer than just the first few days? Are they sleeping the way they normally do? How are their eating habits? Have that changed? Are they not enjoying things that they used to enjoy? Those kinds of what we as psychologists call functional changes are really things you want to pay attention to as signs of distress.
If you do see these signs and are ready to ask or sit down with your child, when and how you do ask is just as important as doing it in the first place.
You want to make sure that you're doing it at a time that's not a high stress or high anxiety time. Sometimes it can help make it easier to talk about situations. If you say to your child, I've noticed that this piece seems to be hard, and I wonder if you might be feeling this way. So giving them that language without saying this is how you're feeling is often really helpful for young people.
And while some of this advice, like just ask, don't do it during a meltdown, may feel obvious to many, it can be easily overlooked as the simplest and most direct way to offer help to someone who is struggling. Dr. Lai also said that when you do identify what they're struggling with, be sure to acknowledge it and validate the feelings that your child is having and causing them distress. That can also help them to build resiliency if they don't feel like they're alone in how they're feeling. Back to you.